Karen, did you know that when you decided to go back?
I knew about Sarah Palin, but I didn't know about the duct tape thing. No.
Well, I know what I'm going to get you as a going away present.
There's
I had
more.
a friend of mine-
In fact,
I had a
that's why they
friend
fix so many of the airplanes up there. They use duct tape.
I had a friend of mine years ago who was based in Alaska, Karen, and he said, I said, how bad was it? And he said, well, there had been occasions where I had walked 20 miles to have a date with an Eskimo girl, and she wasn't very attractive, and I was very happy. So he said it was very, there's some long winters, and but he loved it, actually. I've never talked to anybody that didn't love it up there.
Well,
For all
Karen's
sorts of
from
reasons.
Alaska, so.
Yeah.
What's like,
Oh, well, then you-
What's the name of the city again?
The office building is in Wasilla, as Marky's painted so prettily. But
Oh,
we're
my
looking at living in Palmer, which is where they have the state fair and where they grow all the big vegetables that you hear about.
Oh, well, that's great. Okay, that's a couple points on the good side.
Yeah, exactly. We'll
Duct tape versus
counterbalance.
big vegetables.
No, they just
you'll be
duct
able to
tape
see
a bunch.
Russia, too.
They duct tape a bunch of small vegetables together into one big vegetable is what they do.
I'm sure.
you know, they sell duct tape in every color up there.
I'm really looking forward to that, Marky. Thank you for turning that direction into a more positive way.
Oh, gosh. Well, I see board members signing on. And let's see, we have 1, 2, 3, 4. We got 4. We don't have quorum yet. There's Kim. Hey there, Kim. Okay, well, we're going to have to wait a few more minutes.
Everyone.
Hi, Kim.
I think you do now, Marky, because you have Greg, Jeannie, Linda, and Brent as voting members.
So we're good to go? Okay. I've got to pull up the agenda again. Well, come on. Do we have quorum? Okay, I'm going to go ahead and call together the Pitkin County Public Health Board. It is 1:01, and it happens to be the 12th of November. And I look forward to everyone participating. We've got a wonderful agenda today, a pretty significant work, particularly the work on our strategic plan. Seems like it was a year ago. But before we get started with that, I'll see if there's a motion for approval of the most recent minutes. Anybody, a motion to approve minutes?
I'll make that motion.
Thank you, Ann. Do I have a second? Thank you, Linda. I see your hand go up. Okay, all in support, raise your right hand. Okay, they are approved. Okay, Karen, I'm going to turn it over to you.
Sure. So we have on our agenda today an opportunity to talk a little bit bigger picture than COVID around some work that we have done in the last year. And so we have a guest with us. We'll start with Ona Crow. I'll tell you a little bit about what she's going to be bringing to you all. And then we're going to move on to our metrics with Dr. Levin and Josh. I think it's a good time to check in to see where we are. As we all know, it's a little discerning, something really not comfortable is what I'm trying to say, situation that we're looking at right now. Then we'll move on to talking about what's happening with the state dial and our conversations with CDPHE. And then finally, we'll end with talking about testing and having a couple of different folks talk about the landscape and current state situational awareness of testing in our community. So with that, so Ona, as you might remember, came to work with the board on January 24th. We did a 6-hour, I think, retreat at that point in the library, and the board had identified some high level priorities that they felt like were important for the team to be addressing really actually this year. Our goal with that meeting was to accumulate those priorities, bring them to a staff retreat, and then have the staff do the same process and then sort of cross-cut the two to see where the board was identifying priorities and where the staff were identifying priorities, and come up with some shared priorities for the year. Because of the pandemic, that work really has honestly been put on hold. But what we were able to do was have a brief staff retreat in October, and did some high-level visioning for the department to look at 2021. And what was really actually pretty cool was that a lot of the things that the staff identified really did kind of align with what the Board of Health had identified. So Ona's going to give us a very high-level kind of synopsis of that work, but I really hope that this will help both the department and the Board of Health to have a clear sense of, beyond COVID-19, what can the department be working on in 2021, knowing that COVID-19 is the top priority and will be probably for the whole year, regardless of vaccines coming through. It's still going to be kind of a long haul, I think, until we're back to a new normal or a more normal world. And so we really wanted to walk you through a staff recommendation of what the second priority could be for 2021, and get your thoughts on that based on the conversations we had. So I'm going to turn it over to Ona and let her share with you some slides.
Oh, well, hi everyone. And yeah, it does feel like it's been a lifetime since we had our board retreat back at the beginning of the year. Like just so much has changed since then. I want to start with just having some gratitude for the Board of Health setting aside that time to come together for that retreat, for the staff taking a full day out of their, regular responsibilities to come together, and for everybody that's been a part of putting this, I don't want to call it a pseudo strategic plan, but strategic-ish plan together to help guide the department over the next year or so. And so for our conversation today, we're going to do a little bit of an opening just to kind of gather ourselves and bring ourselves together. And then we're going to chat a little bit about the process. Karen did a really beautiful job of that, so we might skip over most of that. And then we're really going to kind of dive into the Board of Health, the goals that came out of the retreat. Then we'll talk about the goals that came out of the staff visioning. Then we'll spend some time talking about sort of the common themes, and then have a little bit of time to share your reflections on all of that. So coming into our opening, I'd like to just pause. And if you'd like to turn off your video for this, that's fine. If you'd like to keep it on, you can. But I want you to just pause and take a moment to acknowledge all of the different people that are part of this group as the Board of Health, that are part of the staff, that are part of the county level, that all work together on the important work of the public health department. And so go ahead and close your eyes, sit up nice and straight in your chair, and then just take a full breath. And then let it out slow and gentle. And in your next breath, I want you to recognize that you're not alone in this. That we have all of these other really smart, really amazing, really passionate people all working together in this. And in your next breath, I want you to feel the cohesiveness of this group, the togetherness of this group of all working towards your shared goals, the betterment of your community, protecting the health of your community. And take one more breath, really feeling into that cohesiveness past any conflict that may be coming up, beyond any tensions, and really connecting into the cohesiveness of the group as a whole, the Board of Health, the staff, the county, all of the people that are engaged in this together. And then take one more full breath, the deepest you have taken today, slow and steady. And then slowly let it out, letting yourself feel grounded and more present in this moment. And then coming back to the whole group. And if you would like to turn your camera back on, you may do that now. So I like to always kind of take a moment at the beginning of things to like just pause and allow ourselves to be present for a moment. It's good for our own well-being, but it's also really good to remember that we're all in this together. And that's really what a strategic plan is all about, is recognizing that we're all working together and aligning our shared goals. So talking a little bit about the process, I think, again, Karen did a beautiful job of this, so I'm not going to belabor this point, but we did do that Board of Health retreat in January. We'll talk about those high-level goals first. Then we did the staff retreat, which was really focused more on team building, getting the team together and connected with that visioning session. So we'll talk about that visioning session, and then we'll talk about the common themes that came out from both of those. So these are the themes that came out of the Board of Health retreat. So this first one, the prioritize unmet core and unmet mandated services. This came out of an assessment that the department did a while ago around how well and how many of the overall mandated services the department was meeting. And while the department was meeting mandated services across all the different categories, there were a number of items underneath each category that were not getting met. And so the board recognized that as a priority that they would have liked to have seen moving forward. Again, this all came before COVID. And so let's kind of keep that in mind as well. The second one is to prioritize prevention and build resilience across all ages of youth. And so this is focused more on behavioral health, like healthy relationships, mental wellness, prevention of substance use disorder, violence prevention, and generally supporting youth across the developmental spectrum in growing up happy and healthy. The next one is also related, but incorporates adults as well, but to focus on addressing substance use disorder. So one is preventing, and this one is addressing. So when folks have found themselves in a place of having a substance use disorder, that there is access to treatment and recovery services in that. Next was improve mental health. And this was complementary, again, to addressing substance use disorder and promoting resilience for youth. So these aren't all like super distinct boxes. There's definitely flow through across all of these. But this is really focused on building, oops, I'm sorry, there is a little typo here. Improving the mental health and supporting wellness across all ages in the community. And so an important aspect of this that is related to the next box is also taking into account climate anxiety, as well as the impact of social media on mental health. And I think that it's pretty obvious that the trend lately has been that the increased use of social media has impacted mental health, as well as so many other things that are related to the pandemic and the civil unrest in our world right now. So next was the prioritizing climate action, and especially around air quality for the community. And this was selected based on concern that was expressed from the community in general, as well as a focus on improving air quality in the community as well, again, from the community. Next was to increase access to integrated medical services, especially for older adults and seniors, recognizing that there is that need for medical services that are more coordinated and easier to access for everyone, such as basic access to health insurance and medical services, and then as well as recognizing that there needs to be services that meet the needs of specific communities and demographic groups, such as the Latinx communities, and generally just wanting to ensure that there are services that are accessible, culturally competent to meet people's needs across the spectrum of life and across the spectrum of things that they need to be healthy as far as their physical health. And then finally, this one is more focused on capacity building or the kind of internal capacity of the department, whereas the others are more externally focused. The priority here was to build cross-sector partnerships and recognizing that the public health department can't do all of the work alone and shouldn't do all of the work alone. And so building those partnerships across sectors and building those relationships is really essential in meeting and supporting all of the other goals of the department. And so that was a lot all at once. And so again, these were the high level goals that came out of the Board of Health retreat. And there are a lot of them, and that was actually intentional because the intent was to take them back to the staff to sort of narrow them down and refine them, and then bring them back to the board for that final approval. So that's why there's a lot. And then I think we'll move just straight into the staff retreat visioning. And I think you'll notice the overlap here. Again, the Board of Health retreat was just before the pandemic, and so there was not an opportunity for the Board of Health to integrate that in. So you'll see that reflected more here in the staff visioning. But we see the overlap with mental health, with climate change, with youth substance use prevention, and then also leveraging the positives from the pandemic. So an example of that is the Board of Health identified strengthening cross-sector partnerships. That's been one of the things that has really come out of the pandemic is the public health department now has so many more relationships, so many more organizations that you're working with in a positive way than you did before. So there are a lot of strengths, a lot of positives that have come out of the pandemic that the staff really want to see moving forward. And for the kind of internal capacity building, the public health staff feel that the team that they have, which is now bigger than the public health department has been in the past, it's a really positive team. There's a lot of really smart people that bring a lot of value. And so maintaining that positive team and that support of each other is really important for the staff in moving forward. Yeah, and so that wraps that up. Karen, did you want to add anything to that piece about the staff retreat?
No, I think you captured it very well. And as Una said, as our team grew from 8 FTE to, I think by the time we had our retreat, we were probably at 24 or 25. And a lot of team members have come on virtually, but we've never actually been in an office together. It was really important to have time to just spend together, to get to know each other, to start to build a team culture. And that was really a big part of that. And then this visioning was kind of the second part of it too. Wasn't super, we were going to do a SWAT and all sorts of exciting things before COVID-19, but I do think that what we got out of this does match and align nicely with what the Board of Health had talked about earlier in the year.
Yeah, and I would like to add that we didn't tell the staff what the Board of Health had prioritized before they decided on these. And so these all kind of came naturally out of the staff. And so I think that it says a lot about how well the Board of Health is in touch with community in the same way that the staff are in touch with the community to recognize that there's a lot of the same priorities moving forward.
Thank you very much, Ona. Any questions or comments? From
Oh, I'm not quite done yet.
Oh, I'm sorry, sweetie.
Oh, it's okay.
You took a pause. Okay, go ahead.
Thank you. Yeah, so let's move on to kind of the common themes. So overall, these are the common themes that really came out of both the board and the staff, kind of overlapping those. And I'm adding in the COVID-19 response to the Board of Health, because even though you didn't identify it as a priority at the retreat, I know that that is like the primary, just in conversation with Karen, and obviously being the public health department, I know that's a big priority. So I've included it in, but we see that mental health, climate change, and prevention with youth were kind of the big overlaps for the external goals. And then the internal capacity building is to maintain and expand the cross-sector partnerships, and then to maintain the increased size of the department. At the Board of Health retreat, we talked about expanding the size of the department to help meet those unmet mandates. And so that's happened. And so I think that maintaining that bigger size so that as the need for such an incredible COVID response diminishes, well, it won't disappear, then you guys have this really incredible opportunity to maintain the size of the department and shift people around so that you're meeting those mandates before. So I think that it's a really cool time for you all when we're thinking about moving forward. And finally, the staff had kind of revisited those top themes and had agreed among the staff that mental health would be a good top priority for when you're looking at 2021 to include, in addition to the COVID-19 response, which is not going to go away. But the staff that are on the call, if you'd like to kind of pipe in here a little bit and share from your perspective as well. But overall, I think we all recognize the impact that the pandemic has had on mental health across the board for a number of reasons. And because of this, the staff felt like that would be a really good focus for the department to look at for 2021. Let's see, so Suzuho, Jordana, if one of you maybe wanted to share just a little bite-sized piece about why you feel like mental health was a top priority for the staff, that'd be great. I know I'm calling on you without telling you I was going to, so you can totally pass.
Thanks, Anna. I think that mental health has been a priority. It's a priority in our public health improvement plan. It's a priority for the community. And I think that, as you mentioned, COVID has really only heightened how we are all recognizing that this is a priority in the community. And so I think that the staff felt that it would dovetail really well with the work that we're already doing on COVID. And also that it would really elevate the mental health work. We've been participating in some mental health work throughout COVID, but I think that additional level of focus help raise it up. And it could really help raise it up. And I think Karen just messaged me that there's additional feedback from the team that was sent along to you that you might be able to share those collective voices in addition.
Yeah, thank you, Jordana. And I will have to pop out of my screen share to share those.
Okay, I do see a question. Brent Miller had a question or a comment.
Okay,
Oh,
I'm not
just a
actually
quick
getting the
comment
chat. Go ahead.
Just a quick comment relative to the mental health issue. I just read this morning that 1 in 5, 20% of people that contract COVID have a legitimate mental illness, I hate to use that word, but that's what it is, diagnosis in a 90-day period. So 20% in 90 days, and I'm sure that population is skewed, but still that's a spectacular effect of this whole thing.
Yeah, thank you, Brett. I saw that article come out this morning too, so I think it makes this even more relevant for us at this point. Yeah, I'm just kind of looking at some messages from the staff. So one of the staff members shared that, like, with the tumultuous election, with the civic unrest, the need to focus on, to refocus on the national public health system response, and as the economy settles down, like those emotional stressors and the debilitating angst that I think, a lot of folks in our communities are experiencing, makes mental health more of a priority at this time. All right, give me just a moment here.
We have a few more minutes left in the presentation. I've got to keep us on time because we've got to discuss.
So I just kind of want to close with, sorry, I'm coming straight out of another meeting, so I'm a little bit not quite where I like to be normally. So I'd like you to just take a moment to reflect on, first of all, can the board support the mental health as the secondary priority on top of COVID-19 and moving forward for the next year? I think that's kind of the big question right now, and that's for 2021. And I think the intention is to kind of get through this time right now and then take some time to reassess in the future. And then if so, how can the Board of Health continue to provide leadership in those key areas of mental health and the COVID-19 pandemic to best support this amazing department in moving forward? And then Marky, if we have just 1 or 2 minutes, a couple people could share out their thoughts on that.
Okay, I'm looking to see if there's some hands going up. Well, firstly, I would agree with your assessment and the staff's comments about mental health. Needless to say, we have lived through a tumultuous election, which is still not over. We've got a pretty high unemployment rate. We have people with financial needs, and we have a COVID. And in the South, they call it the COVID. And as you look at that, every one of that is stress related. And as I saw Josh's statistics come in a few hours ago, we as a board and as a community really need to find methodologies and ways that we can support one another and try to listen very carefully and support the mental health initiatives. Because at the end of the day, we've got to find some peace and calm in the world, which will help mental health. So I'll see if some other people have some ideas. I'm not seeing any hands. Greg, go ahead.
Great, thanks. I think we don't have experience with a pandemic or post-pandemic mental health recovery. So we're going to be, and our public health officials will be making it up as they go. But we do have experience with economic crisis, and the economic fallout after the pandemic is significant enough that I think that may be the most tangible effect for some people. Is that, yeah, there's the uncertainty of COVID, but there's the certainty of economic ruin if you've lost your job or your livelihood. And we do have experience with that. And I'm hoping our public health can draw on, how does a public health department respond after an economic crisis? And so there may be some existing research and existing best practices that we could draw from for that. And that might help inform us for the other part of it too.
Thank you, Greg. A very, very excellent comment. Other individuals? I think we've got a lot to chew on as we look forward to, Greg, as you so eloquently put, comments about economic recovery, the pandemic, the current state of affairs in our country. And I would look forward to a full conversations and strategy development by the board over the next few months. Anyone else?
I'd like to comment that I've dealt with community problems on a large scale before I came back to Colorado and Dallas, where there were thousands of school children exposed to asbestos, another situation with school-led exposures. And I think maximizing the information, the lesson that I have from that is maximizing that information to the public. So as we gather information, let's not just be quiet about it. Inform the media and get them involved so the public has some confidence in what we're doing and what lies ahead.
Well said, Tom. Okay, I'm
Yeah.
looking around for final comments. Okay. Anona, is this your last?
This is my last little bit. Yes, I just want to invite us all to celebrate the success of somehow managing to come up with some strategic planning priorities in the midst of a pandemic. And I also want you to remember to celebrate the successes that you have had over the last 6 months or so. So Tom, you're talking about data, your public health department, the level of data analysis that they do is an incredible strength, and you should be celebrating that. Your public health department has been taking the lead in a lot of ways throughout the pandemic, and other health departments are looking to you for leadership. And so I just want you to remember that you all are doing great work, and remember to celebrate that. So with that, I would like to thank you all for your time today. And please feel free to go ahead and reach out to me or Karen if you have any questions or would like some follow-up information.
Thank you very much. Bye-bye.
Bye.
Josh, I know you've got a wonderful report to share with us today, and Kim. So we're waiting for all the good news, Josh.
I wish I had more to share, Marky.
Well, come on. Let's stay on a positive note here. We can beat this.
Am I sharing my screen or is, oh, perfect. Okay, never mind. Okay, so in the past, I've been starting off with talking about other countries and what they're doing and what they're seeing, but really, I think we just need to emphasize and focus on what's happening here in the US right now. So I just threw a few different headlines from different news sources onto the slide just to give an idea of what we're seeing right now. And really what we're seeing is record high cases, record high hospitalizations, and now we're beginning to see deaths starting to increase. And as we know, after cases increase, we see hospitalizations increase, and then after that, we tend to see deaths increase. So that's what we're seeing right now. Some different news sources and experts are warning that the next few months could be some of the darkest days yet, is what they're quoting and citing. especially if we don't get a handle of things. So we are not in a good space right now in terms of our case counts, hospitalizations, and now increasing death rates. And that is true for essentially the entire US. We're just seeing an explosion of cases hitting highs that are much higher than we saw earlier in the pandemic. 145,000 new infections just yesterday is a staggering amount of new cases. Next slide. So these are what the national trends look like right now. So the 4 graphs on the left-hand side, you'll see the purple are daily tests that have been conducted. Those are per day. Then we have daily cases in the red / pink salmon color, hospitalizations in the blue, and then deaths over in the gray. So you'll notice that there's a huge explosion and surge of cases across the entire United States. That little red dot there means that it's an all-time high. It hit a single day record, as I just mentioned, of 145,000 new cases. And so now what you'll notice in the blue is that hospitalizations are starting to increase. So that darker line is the trend, and then that lighter blue is where hospitalizations are at. So we currently have 66,000 people hospitalized across the US right now. And then in terms of deaths, there's been some discussion in the news about why deaths have not been increasing. And it was really because case counts were going down for a while, and we weren't seeing as many people hospitalized. Now that those are starting to go back up, we are starting to see deaths increase again. And so we know that, again, it's a lagging indicator, but it's a very concerning trend that we're looking at. And then over on the right-hand side, that is a map looking at hospital capacity by state. And so you'll notice that in the mountain time zone and over into the Midwest, hospitals are beginning to reach pretty significant capacity, and then the hospitals are becoming very strained. This is looking at percent of the beds that are COVID-19 patients. You'll notice in North Dakota and South Dakota, over 25% of their hospital beds are filled by COVID-19 patients. You'll see that reddish pinkish color surrounding those states. We're seeing a surge in this part of the country, whereas over on the coasts, we're not seeing that surge at this point. So it's really affecting the middle of the country right now, and there's significant strain on the hospitals. Next slide. So when we look at our local data here, our 14-day incidence rate is now at 287. That is the highest that it's ever been. We peaked into the 300s the last 2 days. Again, much higher than we've seen previously. We saw our incidence hit about 258, I believe, back in July. And so now we're seeing that our incidence rate is peaking above that. We've had 56 cases in the last 14 days among Pickens County residents. We've had very few out of jurisdiction cases. Basically, all cases are Pickens County residents at this point, and it's Pickens County residents infecting other Pickens County residents. We are seeing, of course, some Eagle and Garfield impact, but not to the extent that we were seeing several weeks or months ago. This has really become localized here to Pickens County. And so then looking towards how we measure up in comparison to the dial, or using the state dial metrics, we've now been in the orange according to our local data for 13 days at this point. And so you'll notice on the map there that we have been increasing since about September. We hit a lull back in the middle of October, and now we're starting to see a rise again in cases. Next slide. So this is just showing you the incidence rates by county. I think Dr. Levin's going to discuss this a little bit more, but I just wanted to show this to you real quick, that this is what the different incidence rates per county are as of yesterday's report. And so you'll see, for example, Summit County, their incidence rate is 1,026. So that's about 4 to 5 times higher than our incidence rate. Garfield and Eagle, they're in the 400s. Mesa County's in the 800s. And so we're just seeing increasing cases across the entire state. And they are all seeing incidence rates above that 350 threshold. That's what that red is indicating. The orange means that we're between 175 and 350 for our incidence rate. So again, incidence rate is a way that we can compare the counties to each other. And so as we're comparing, we're not seeing much difference. All counties are being impacted right now pretty severely. Next slide. So then looking at our positivity rate, there's some differences from the dials data from what we have, but our current positivity rate is probably right around 6 to 7%, just taking in all the different data that we have. So we have seen our positivity rate increase as well since about mid-September early October. But we are doing a lot of testing. The hospital has been a huge partner in supporting public health with testing referrals. So we've sent over 750 referrals to the hospital in the last month and a half. And those are for people that were exposed or potentially exposed to COVID, and the hospital has been able to test every single one of those individuals. So they've been a huge partner in ensuring that we are getting people tested, and that local residents have the ability to be tested when they need it. But our positivity rate has been above 5% or above that safer level 2 threshold for 21 days now. So we've seen the positivity rate pretty high. Again, on the dial, it's not going to reflect that. The dial has our positivity rate lower, but according to our local data, we have had a positivity rate above 5% for about 3 weeks. Next slide. And so this is what I was referring to. This is comparing the positivity rates between all the different counties. And so you'll see Pitkin there is in the green, and on the dial we stayed in the green. And again, it's a reflection of the amount of testing that we're doing, and so that the state is capturing all the different tests that we're doing, and so it is keeping our positivity rate low when looking at the dial. You'll see that around us, positivity rates are increasing pretty dramatically. Summit County's at 17%, Garfield and Eagle are both in the yellow, and then Mesa County has now recently moved into the orange. So again, as our incidence rates are increasing, our positivity rates are also increasing pretty readily. Next slide. And then I just took this screenshot from CNN. This is positivity rates by state around us. And so I just want to show you, it might be sort of hard to see, but these are the positivity rates in the states, or positivity rates by state. So notice that Wyoming, their positivity rate is 36%. South Dakota is 54%. So out of every 2 people tested, 1 comes back positive. Or out of every 100, 54 coming back positive, which is just an extremely high positivity rate. Kansas is at 37%, Iowa 48%. But you'll see, again, the middle of the country is being impacted by COVID right now. And the coasts are, for the most part, being spared at this point. But we know that it'll probably branch back out and begin to affect the entire country. But right here in this part of the country, we're seeing positivity rates hit record highs. Next slide. And then looking back at some more local data, this is our cases among those who are 17 years of age and younger. And so we have seen an increase in those cases. So in August, we had 2, September, we had 4, October, we had 5 cases in children, and now as of November 11th, and we've already had 8 cases among children. So we are starting to see the virus really impact children and infect children. So, we think that this is probably true all along. There's not as much testing for children, but we are seeing them starting to be pretty impacted by the virus here in Pitkin County. And then the bottom is the positivity rate for children. So again, that's been increasing just as we've seen the positivity rate increase for their overall population. Next slide. This is exposure source, so where individuals are being exposed in Pitkin County. This is over the last month. Our community spread number, over the last 14 days. Our community spread number is at 33%. So 1/3 of our cases cannot identify how they were exposed. 11% were exposed at work. 12% were out of state, and then 19% household. So they were exposed by someone that they live with. And then there's a few other ones that are a little bit smaller in terms of where they were exposed. But really the main point here is that community spread is really high. So that means that we have more cases in the community that we're likely not aware of. And so there's individuals out there who have not been tested who are likely spreading the disease to others. Next slide. This is our current estimated prevalence in Pitkin County. So prevalence is percent of individuals currently who have COVID-19. So we're estimating prevalence to be right around 0.5%. So every one of about 217 residents right now, we think are COVID positive or have COVID. Some of them have not been tested, some have been tested. This is our best guess at where we're currently at right now. Illinois, for example, is at 1.4%. So states are just seeing extremely high prevalences right now. 0.46 is right around, it's slightly lower than the national average. I think national average is about 0.6, 0.7 right now. But prevalence has been increasing. In terms of isolation and quarantine, we have 31 individuals currently isolated in Pitkin County. We have quarantined 271 individuals. Of those 271, 201 are Pitkin County residents. So a large increase in the number who have been isolated in quarantine. Next slide. These are outbreaks. So this is a map of all the outbreaks across the state. Over on the right-hand side, those are our outbreaks here in Pitkin County. And so you'll see that we've had 13 outbreaks reported in the past month. Informal gatherings, we've had 4 outbreaks due to informal gatherings, resulting in 23 cases. We've had 2 outbreaks due to carpooling, which has resulted in 7 cases, 7 outbreaks at a workplace, resulting in 19 cases, and then 1 outbreak at a school/childcare, resulting only in 2 cases at this point. Next slide. And then last thing I really wanted to focus on was an article that came out that I thought was pretty interesting to really show how the virus can spread in different environments. And so this graphic here is showing 2 different settings based on different strategies that are used. So on the left-hand side here, you have individuals in this social space. You'll see patient 0 is circled on the left-hand side. That individual is the one who has COVID. If they were in this space for 4 hours, so it's a long period of time, even though they're wearing masks, without any ventilation, those are the red individuals, or the red silhouettes of the number that would be infected after that 4-hour period of time. The green would not be infected. Over on the right-hand side, this is only 2 hours worth of time. So if that patient 0 was there for 2 hours, everyone was wearing masks, but there was proper ventilation, you'll see that it really only results in 1 case. So it echoes and shows the importance of ventilation and mask wearing and how those different strategies can work together in unison to prevent additional spread of the virus. Next slide. And then this one's in a classroom, which I thought was pretty interesting because we, as we've been sort of, working with our schools and trying to explain, the concern over aerosolization of the virus. This is an important graphic to look at to try to understand how it works. So on the left-hand side, this is children in the classroom for 2 hours, assuming the teacher is patient 0. You'll notice that without ventilation, even though individuals are wearing a mask, you see about half the class is infected. Over on the right-hand side, with proper ventilation and only in the classroom for 1 hour, you'll see that only 1 additional person is infected. And so, our schools have been really focused on ventilation and ensuring that these strategies and mitigation strategies are in effect. And so, I think, to see this research come out and to know that, ventilation can truly reduce the amount of individuals that are infected is encouraging to see. But it also, reminds us that even though we're wearing masks, even though there is ventilation, there is still a risk for the virus to spread. So it's not foolproof. Next slide. And we can skip this one. Next slide. Okay, so then it's my last slide here before I hand it over to Dr. Levin, are just some recommendations and thoughts from an epidemiologic and contact tracing perspective. And that's that right now, it's critical that we reduce numbers before we move into the winter season, really to avoid overwhelming our hospitals. This is what we talked about early on in the pandemic, that we wanted to flatten the curve. Now is the time that we really must reduce numbers. And so it is a community effort. We must come together to ensure that our hospitals can remain have the capacity to ensure that they can take care of anyone that needs care, regardless if it's COVID or something else. And so that is a community effort that we need to take upon ourselves to ensure that we are reducing numbers moving into the winter. We need to limit our social gatherings to our household of no more than 5 people and reduce the frequency of our social gatherings. And so a lot of scientists around the country right now have really been encouraging individuals to create a bubble of individuals that they will stick to for the next few months. So you find 5, 6 people, those are going to be your people that you will meet with, and that's it. You don't let anyone else into that bubble. And that is one way in which you can really reduce the spread. So we really encourage that individuals consider that guidance and really try to limit their interactions with other individuals. And then again, just don't let your guard down. Always wear a mask, even when you're not within 6 feet of someone, because as I just showed on those previous slides, it's not foolproof. The 6 foot, 15-minute piece is great guidance. It's not foolproof. We've seen plenty of cases come from individuals that had less than 15-minute of exposure or were more than 6 feet away. So it does happen. Don't let your guard down. We're hopefully on the verge of some really exciting things in the next few months. So it's really important that we don't let our guards down. And then finally, get your flu shot. We see that, flu, individuals that are infected with influenza, some of them end up needing hospitalization. We want to ensure that we can reduce our flu counts as much as possible and ensure, again, that our hospitals have the capacity to take care of those who need it. So with that, I'll hand it over to Dr. Levin.
Great, thanks so much, Josh. And I'm really going to add on everything that Josh has talked about. The numbers are daunting. The upward trajectory is daunting and frightening. And the wave, calling this the third wave that we're in, the models are showing that we're in it for another couple months, probably, that possibly the peak of this wave may be in January or the end of January, predicted at this point. So I think everything that Josh just said, I really enforce. The time is now to act and to be diligent as much as possible. I'll present some of the Colorado data, the nation data, Colorado data, and then the AVH data, and I'll go through some of these slides quickly, but this is from the CDC website. And again, as Josh had presented, the highest numbers are really in the Midwest and really kind of surrounding us in a way. We're in it. There's been this shift into a rural setting. And importantly, as Josh had said, that the hospital capacity is what is really starting to gauge where we are right now. And Wisconsin and North Dakota have both set up field hospitals. And this map showing, and then the positivity rate that Josh had shown of all of these surrounding and northern states is just completely off the charts and really very concerning. I wanted to point out from this map where we are in Colorado, in terms of hospitalization data, and I'll show that a little bit further on. I have another graph on hospitalization data, but that just to get a little more of an awareness that as a state, we have these front range hospitals that are going to be taking transfers, and then Grand Junction as well. But in Colorado as a state, our catchment area for hospitalizations, we have a lot pre-pandemic. There's a lot of pre-existing relationships with surrounding states for transfers. And so we as a state have actually taken care of pre-pandemic a lot of ICU patients that get transferred in from North and South Dakota and from Wyoming. And those existing relationships are still existing. So there's an additional stress on Colorado in terms of being this catchment area for hospitalizations. And in the ER, we're seeing the effects of this now. Not just that, but just Colorado itself, Colorado residents filling up and hospital capacity starting to become a concern. Another important thing is that the Colorado Hospital Association is starting to create, which I think is a bright spot here, kind of a centralized database for COVID transfers only. So they'll be able to try to help in terms of how to transfer patients. And these are all the conversations that we're having now, again, reflecting the data and everything that Josh had shown. Next slide. And this is just in terms of looking at the cases in the last 7 days. If you look down, you'll find Colorado is on this top 25%. In fact, it's between 15 and 18 in terms of our number of cases in the last 7 days. So we're in there. We're right in this section in the United States, and it's extremely concerning. Next slide, please. This was last week, and these are the safer level 1, 2, 3 as the state defines each county. And then if you compare it, so the darker orange is the more concerning. Last week, there were 2 at safer level 3. Next slide, please. This is this week. We've got about 18. And most likely next week, it's going to be a lot more orange. So I just wanted to show this to show how rapidly everything is changing. And again, to reinforce the message that the time is now to act and try to change some of this trajectory. Next slide, please. This is not as useful, but everything is orange. I mean, we're looking at everything is in the very high. There's only 3 counties that are in the high level in terms of a 2-week cumulative incidence rate. So this is what's driving these changes up to the next level that the state is designating each county. Next slide. Thanks. Okay, in this slide, which I show every Board of Health now, and the cases of COVID-19, this is, I think, over average 3-day average, but really, if you look at, we thought we surged in July. Look at the numbers now. We've hit 3,500 a day, and it's actually been a little sustained over the past couple of weeks. So again, we're testing more, but these numbers are extremely concerning. Next slide. This is the red line is the positivity data in Colorado, and you can see if you go across that it is in this upward trajectory. Even in the last week, it has crossed into, it's up close to 12%. We wanted to stay below 5%. And now we're consistently now above 10%. So again, extremely concerning in terms of positivity. And then as Josh had pointed out, some of our surrounding states are significantly higher than this. Next slide. I just want to look at the age groups a little bit earlier on in this wave. Really, a lot of the additional cases were from the 20 to 29, 30 to 39. And you can see the percentage, and then the kind of grayer box below is the percentage that reflects the population percentage. So there's still these 20, 29, 30, 39 that is responsible for increasing. But now what we're seeing kind of a month later, if you look at the next slide, that every single age group is contributing to an increase. And so we're seeing increases across all age groups now, not just the 20, 29, 30, 39, which was kind of responsible earlier on in this wave for pushing the numbers up. Next slide. And then this is the frightening graph in terms of hospitalization. And again, we're kind of looking at capacity to be able to address this pandemic by being able to take care of the sickest people in hospitals and having resources to do that. And so we have just surpassed the hospitalization rate in April. We're up to, I think it was just over 3,000. Yeah, sorry, 1,300. So yeah, 1,300. And so what's concerned about that is not that we've just surpassed what we had in April, but look at the angle of this going upwards and where is it going to reach and how much further are we going to go? And that's what we've got for the next couple of months to try to change that trajectory as well. Next slide. I know Josh had mentioned this as well. We're looking at 3-day average deaths of COVID-19 cases in Colorado. And we looked at throughout the summer, it kind of like went up and down, but was basically at a lower rate. Now we're seeing a rise, and we've seen it since the beginning of October. This is kind of a trend that has started. And again, deaths always have a lag period behind the rise in cases. But we're seeing a rise in deaths now, and that, of course, is another additional concern. Next slide. I really like this graph. This is the outbreaks. Josh showed a different outbreak graph. So together, we're looking at this incredible rise in outbreaks in Colorado starting in the beginning of September. And if you look at it breaks it down by what type of outbreak. The orange section of these graphs is the education is a huge percentage of this. There's also residential healthcare facilities. There were just 10 deaths in Broward County, which is in the southeast in Colorado. This is all happening. It's all concerning. And then the kind of pink orange section of manufacturer construction as well. Again, this is not local data. Josh presented the local data, but I think it's really interesting to see what's going on in Colorado. Next slide. This is just as a subset, outbreaks in educational setting. And these were taken from Dr. Jessica Cataldi from the state. So this was last week. If you look at the number of active outbreaks, which are in the orange, and then the next slide, this is this week. And so there's just been this incredible rise even over the past couple of weeks. And again, this is our concern. Next slide. So I'll switch now to AVH data. And I always like to start out with the matrix and explaining the AVH, the Aspen Valley Hospital matrix. What has changed, and it changed yesterday, is that we have, there's 3 different variables here. Inpatient hospitalization has remained in the comfortable phase, and we still remain there. Then there's average daily visits, looking at the emergency department, being the ED, the Respiratory Evaluation Center, the RAC, and the community testing. And we have been in cautious for a little while, and we remain there. What's changed is the healthcare workers, and now have Dave Ressler, the CEO of AVH, make a comment about this change and what it reflects.
Thanks, Dr. Levin. Yeah, we, as the table indicates, have increased from comfortable to cautious with regard to essential healthcare workers being out with COVID and COVID-like symptoms. What I'd like to point out, as you can see, is that the parameters for the cautious level are 6 to 10 out at one time. And presently, we have about 7 people out, but not all of them have COVID or COVID-like symptoms. Some are just various different ailments. But the reason we went to cautious anyway is that a larger number are out at present on quarantine, a larger number of our staff for having been exposed or been in contact with people that have been tested positive. And so most of that is almost entirely occurring outside of the facility. And it's more of a reflection on the viral spread we've been hearing so much about from Josh and Dr. Levin in the community. So it's starting to impact our hospital. And we have asked, obviously, all of our staff to do what everybody else in the community is doing, and that is keep ourselves safe and avoid contact. But as the incidence goes up in the community, we're starting to feel the impact at the hospital. So that is why we moved to cautious.
Thank you, Dave. Yeah, I think the interesting thing that we're seeing here, just to add to that comment, is the quarantine staff. And so people who are not sick with COVID, but that make a significant impact on the staffing at a hospital. And we're seeing this in all over Colorado now in terms of transferring patients to hospitals on the Front Range, that they may have a hospital bed, but they may not have the staff. And so these staff shortages due to quarantining, not just COVID, are having a bigger impact, I think, than had expected. And it's kind of a variable that we're not tracking as much. We're just looking at ones that are out with COVID symptoms. So it's worth making a comment about. Okay, next slide. Thank you. So going through the data points here, this is the AVH inpatient total COVID positive and PUI, and we're down to 0 right now in terms of inpatients. Again, I want to stress that patients who are really sick and beyond our capacities here in our ICU here get transferred. And so this, again, doesn't reflect the transfer data, but it is the current data. And that's why we remain in the comfortable phase at Aspen Valley Hospital. Next slide. The emergency department visits, if you look at since the beginning of September, these are emergency department patients with COVID-like symptoms. We have kind of consistently jumped above the number 6, which is our comfort level, and which would be above the cautious, into the cautious phase. So we're not in there, but we have certainly been going up in that direction. Next slide. And this is the Respiratory Evaluation Center, which has remained in the comfortable. And these, again, the Respiratory Evaluation Center was set up for a physician to be able to see a patient and evaluate a patient and also get a test. So these are the sicker patients that might need to see a doctor, but not sick enough to go to the emergency department. And it's been active, but it hasn't been overactive at this point. Next slide. This, again, is the concerning data point. And this is what has put our daily visits up into the cautious mode for a while now. We 16 community tests a day, and it's just the demand for testing, and this really reflects that, and the increased testing that AVH has been doing in response. So we've remained on average above 16 a day, which has put us in the cautious. What what I want to point out here are these points up to over 40. 32 is our next cutoff. So if we average above 32, it's going to put us another phase above. Right now we're averaging in that cautious, but we're solidly there. We're doing a lot more testing. And this also is a reflection on what we're going to be talking about a little later on in the meeting and all the other additional testing sites that are being set up and have set up. Next slide. And then these are the healthcare workers who are out, which as Dave Ressler had explained, we are just above 6, which is our cutoff, which has now put us as of yesterday into the cautious level. Next slide. These are our total number of tests that we're doing, and the positives on the top, the negatives, the negatives are on the top, the positives are on the bottom and in the blue. Next slide. And as Josh had presented, we're really starting to test a lot more children, and we're looking at these, we're breaking down by age and looking at children a little more specifically as well. And we see that there's different positivity rates among different ages of children, and the 14 to 18 right now have the highest positivity rate. And it's just interesting data that we're looking at more as we're testing more. Next slide. This is off the website, the stats, and it's really looking at the AVH data, all the testing that's being done there, and the consistent rise of our positivity rate, which is in the yellow-orange line. And right now at AVH, we're at about 9%. We're well above the 5% goal, and we've been above there. And it's a little bit higher than what Josh reported of the 7.5 at the state level. But again, the local data and local testing at AVH and state are a little variable. But either way, it's above 5% and concerning, and looks like it's rising precipitously. Next slide. I just thought I'd put this in from Children's Hospital. The orange is COVID-19, and then also tracking other quote bugs, viruses. And I also looked at flu. There's very lower levels of flu right now. I think Josh's message of get your flu shot, if you haven't gotten it already, it's really important to still get it, and you can still get it. It's an effective time to get it. There's only been 3 flu hospitalizations so far in the state, which is below our average, but you can see our COVID-19 really is the most significant bug that's being tracked right now. Next slide. And I just thought I'd put this in. The CDC put a new position on masks. On November 10th, they came out with this statements on the CDC website below. But what I just wanted to, the main point of their change, which I think really is common sense, is that masks only, they don't only protect the other person, they protect yourself as well. So it works both ways. And so the community benefit of masking for SARS-CoV-2 control is due to the combination of these effects. So protecting another and protecting yourself now. And that's the major statement that they put out recently. And hopefully this will increase mask use, knowing that individuals are also protecting themselves as well as protecting others. And I just wanted to put that out there. Next slide. And that's it for me. I think again, the take-home message is echoing Josh's comments of the time is now. I think we have moments to act. I think we all need to be incredibly diligent. We're in this wave. We don't know how big it is, but it's certainly daunting and frightening. And we're seeing the effects of it already in terms of hospital transfers and hospital capacity and ICU capacity. And we'll continue to track it.
Thank you, Kim. Thank you, Josh. Any questions for either individual? If not, then I'm going to turn it to Karen, because the next topic is dial movement alert timeline and next steps. Karen, I'm going to turn it over to you because I think all of the 2 presentations done by Josh and Kim come to combination with the discussion that you want to lead.
Yes, thank you. I did see Greg had his hand up though. Greg, if you.
I had a question for Josh, which I could ask later, just regarding the classroom example that he showed. I had some questions about that, but we can put that off until a bit later.
Great. Yeah. So exactly correct, Marky, that all of the data that Kim and Josh just showed leads us to where we are to date with our own position and the state dial and what the next steps are around that. So next slide. So this is, I won't go, I have similar slides to Kim and Josh, and I'll skip over those, but I do want to highlight this because this was the weekly epi data that we got from CDPHE. And I just think there's a couple other points I would like to highlight, and that is contact tracing and outbreak investigation capacity have been exceeded at the state health department. That doesn't necessarily mean we've exceeded it locally, but the state health department has exceeded their capacity to actually address these things. That we are seeing that the ICU capacity is being predicted to be exceeded in December. I think that was a lot later with the modeling just a few weeks ago. And we're seeing disease rates continue to increase. The strength and duration of interventions need to be reversed. So I think that's an important thing to think about, strength and duration of the mitigation strategies that are going on. It's the time and the efficacy of them. Okay, next slide. I won't do this. This is the same data that Kim showed. It just shows where Colorado is in the nation right now. We used to kind of hover in the middle, and now you can see, as she said, we're in the top 25%. Next slide. And this is also just a replication of what Josh talked about, where we're seeing the incidence rates in our neighboring counties being fairly alarming. Next slide. Next slide. Next slide. And next slide. Okay, so that leads us to where we are on the dial. So the state was monitoring, again, based on the dial data, when we're 3 days out of compliance, and our incident rate was 3 days out of compliance last week. It's the only indicator right now that it's actually out of compliance, but it just takes one. And so on Tuesday, we received a warning email from the state indicating that. We met with CDPHE the next Tuesday this week, and they went ahead and talked to us about what mitigation strategies we were employing, a request to submit a mitigation plan. They have sped up their timeline. So the timeline that you might have observed on their website or we have talked about in the past has changed. So we will be meeting with the state on Monday, and as of that meeting, after that meeting, we have 48 hours, and then we will be moving into the orange color on the state dial. So that's on Wednesday. So I just want to let you all know that that is happening. We'll talk to you a little bit about how we're communicating that. Next slide. So what that means for us is level orange. You can see that a lot of it is just almost having the capacity that we are currently at. So looking at retail going down to 25%, looking at personal services going down to 25% capacity or 25 people. Bars are closed. We never actually opened up bars in Pickens County, so that's not a big difference for us. You can see gyms and fitness go down to 25% capacity, 25 indoors and outdoors in groups of less than 10. Restaurants are down to 25% capacity or 50 people, indoors and outdoors 6 feet between parties. I won't go through all of these. These are all on the website, the CDPHE website, as well as our own website, but I think you get the gist of where we're going here. And that we're really, in essence, reducing capacity in most sectors in our community down to 25%. Next slide. So what I want to talk to you a little bit about is sorry, can you go to the next slide? And then I'll go back up into this one. So how we're messaging this to the community. So we had a town hall this morning at 10 a.m. And that was really an opportunity to share with the community. We're moving into orange, and here are some ways we can support and help you. I'll let Jordana report a little bit more on that. We are working, we have a good integration between the county and the city consumer protection teams to support those sectors. So all those boxes that we just saw on the other slide to really help them understand what it means to meet the requirements of that reduction in capacity, increase in social distancing. Remember, that's why we're doing all of these things. We are also having the communication team work on messaging out to the public and how that's going to look for our community. And then we're really working with community partners to help amplify the requirements, resources, and messaging as well. So we've got a lot of different things going on around education, helping to meet requirements, helping the community understand that this is the direction we're moving in. We hope that by moving into the orange and having increased social distancing, that starts to help mitigate all the data that you just saw from Dr. Levin and Josh, because we know that some of those things will certainly be helping with this strategy to really hopefully drive down those numbers in preparation for what we anticipate a natural spike around Thanksgiving anyway, and a natural spike after the ski industry opens. So I'm going to stop there first, and then I'll go back to the other slide and see if you have any questions about just the process and what we're doing with the state.
Questions for Karen? I'm not seeing any hands, but this is not pretty, is it? Nope. Okay, Karen.
Okay. And that meeting that we're having with the state on Monday will, they want a board representation. So we've invited Marky as the chair to come and sit in on that meeting. John Peacock will be there as well as myself, and just really, again, to kind of get the gist of what the state is, what conversations we should be having with the state around our mitigation plan, which we've actually already submitted to them. So, and it's the one we shared with you a couple weeks ago. And then if you can go back to the other slide, sorry. So what we wanted to bring to you today, and I know this is probably a topic of round robin, is that we have the level orange. So we're going into that, all of those things will be in place. And then we want to talk about other things that have been coming up around both policy and mitigation. And these are things that we are not prepared to talk about today, but we wanted to bring to the board because these are things that have come through the board or come through our partners or come through the staff, to really bring these to your attention and to see within the next week if you could reach out to your constituents and really talk about these ideas. We know that if we amplify messaging through local leaders, as well as talk about these kinds of mitigations or policies with our community first, there'll be a lot more interest and buy-in from the community to actually implement them. And no strategy is good unless we have support to do those strategies. So these are some things that have come up recently. One of them was municipal curfews. So that was something similar to what the city of Aspen did a few months ago, where there was a curfew in the city. There has been some data around decreasing lodging capacity. There has been a lot of talk about traveler requirements, and the staff has actually been putting together a proposal that they would like to bring back to the board around that. We have talked about a visitor pledge, and that's something that we would want the lodging community and Aspen Skiing Company and different lodging entities to really push that forward. That could come from them of, as a visitor, I pledge for the 5 commitments. I pledge to do X, Y, and Z when I come into this community. Certainly work from home is a super easy win if people have the ability to do it. To really recommend that all folks work from home right now. It just reduces people on the bus system. It reduces people in the offices that might be interacting together. And again, we know that everybody doesn't have this opportunity or the privilege of working from home, but those who do should take that opportunity right now. And their employers should encourage that. And then addressing compliance of mask order and gatherings in public spaces. So again, these have come at us from different ways. And we just wanted to put these forth to see if you all have the ability to sort of shop them around and see what the political will is and what your constituents are saying about some of these items.
Thank you, Karen. Greg, you might want to join me in this conversation, the one we had this morning at the RAFTA board meeting. One of the items I did bring up was shopping around traveler requirements, such as the testing 72 hours prior to travel. And then I also brought up the fact that what the state of New York put in place, and that is 2 additional tests within the first 5 days. It had to be negative until you could come out of quarantine. Greg, I thought we seemed to have some support for that from the RAFTA board and the various jurisdictions as well as RAFTA itself.
Yeah, Marky, I think everybody is very concerned about this, and I think everyone would like to be on board. Mainly, I think the biggest concern is that if we go back to the governor of the state and we're rebuffed again because they're looking at the entire state, while we may just be considering our community or the ski town communities where we have the most travelers, their goals are different from ours, I think, and that may be where we've been rebuffed in the past, and it could happen again. So I'd be interested in hearing, where this is going regarding what we can do proactively for our community, and probably, as Patty may be able to help with, bring in other communities as well, the ski towns, the Association of Ski Towns. I know Ann Mullins has been working with them, and as others have with CAST. So it may be time for us to be proactive and start making some demands upon travelers coming to our hotels or to our ski area. And if they're going to book a hotel or book a ski lift ticket, why can't we make a demand on them for an affidavit, a proof of testing, or a commitment to quarantine, whatever it takes? I think that's a conversation that hopefully we'll have, and I'm assuming that's what the staff proposal is going to include. And I'll shop it around more with my constituents, but I think I need to know more about this whole list before I do, just so I can speak more articulately about it.
Marky?
Yes, Patty.
Yeah, the problem is, guys, is turnaround time. We're still having this lengthy turnaround time. One of the commissioners, Kelly, it took a week to get her son's COVID test results back. So it's hard to have somebody come here so that you have to be tested twice while you're here. Well, or quarantine until you have a negative result. We need to look at the fact people come here for a 10 or 7 day vacation. We're asking them to quarantine for 14 days. We have to look at what that's doing to the local economy. I know public health is a priority, but we also have this issue of the survivability of our local community. And that's really important. The second thing is, and I have to take this call, I'm sorry, is this is something we should run through ACRA and have them put that out for some input on these strategies.
That's a good suggestion.
If I could just respond.
Yeah.
What I was talking about is actually having visitors to Aspen make that commitment and get their test before they even get on the plane to come here. As Patty points out correctly, once they're here, the cat's out of the bag. COVID's out of the bag. What I want to see is a commitment that you've been tested after you've made your reservation before you come to our valley. And I think that's what I was talking about. So
yeah,
it's not
agree.
on arrival.
My example was what came out today or last night in the state of New York. That doesn't mean that I would support doing something because we don't have the ability to do turnaround tests as quickly as what they have in the state. But I'll see other board members. Ann? I think Ann's still on.
Yeah, I'm here.
Okay, you've been talking to CAST, haven't you?
Right. I think Tori and I both have. I think Tori may be able to give a little more information about that.
Yeah, CAST has actually been in direct contact with Jordana. We have asked other ski areas for their support about a statewide program. There are currently, as of last week, there were no CAST members that were having a visitor pledge or traveler requirements as of last week. So they were appreciative of us forwarding this, but truly we are forwarding it. It was not coming from anywhere else or employed by anybody else. So sure, the latest rounds of results and data are going to push them more and more in that direction, but I think that we can be gaining more and more support for statewide measures.
I'd like to hear from Kim Levin to comment on the additional testing that might be performed at Clark's Pharmacy with perhaps a more rapid turnaround. As well, Jeannie Siebold has implemented some testing of school children. And how was the turnaround performed in that situation? In addition, those secondary forms of testing can increase the total number of testings, which might lower the percent total positive in Pickens County if the percent negatives in those additional testings were lower.
Okay, great, thank you.
Okay.
Yeah, I know that we have a whole section coming up in this meeting to discuss the full spectrum of testing coming up. And so I'll just wait to comment in that part of it about Clark's, but there's a lot that's coming and we'll discuss it in just a minute. I do agree with your positivity rate. If you have more negatives, you're going to decrease your positivity rate. But I think in terms of this traveler requirements, there are 17 or more other states that have some type of a traveler restriction in place. The state of Vermont, which is the lowest in the nation, just enacted a quarantine for anybody, even if they go out of the state for the day and come back in. So there's more and more states that are doing this. And I think urging the state of Colorado to do it is a great idea. I think a statewide measure is a much better way to go than, you know, if we had to do something locally and try to coordinate on a tri-county level or something. So I'm in full support of that. And Tom, hopefully I answered your questions or will answer them.
I agree with that as well.
Brent, I saw your hand go up.
Well, I was really just now, it's gotten away from me. I totally agree with Dr. Levin and Greg, and I'm sure Tori. Is doable. You know, I've always felt that Aspen's more like a cruise ship than it's like anything else. And every week everybody gets off, but on a cruise ship, they do get off and they go somewhere else. And I think only reasonable, all cruise ships, you can't get on without being tested. And I think that's for me, it's a good analogy that we could be very active if we could figure out a way to do that effectively.
Okay.
And
Greg?
and we need to move forward and maybe, like Greg said, push this.
Well, yeah, thank you. I think from what I heard from Tori is that no of the other cast members have done this yet, but it doesn't sound like anyone is leading on it. And what I heard Kim say is, yeah, sure would be great if we could get the state to go along with us. Are we just going to wait for them to do that? Or I think this board could make a decision, and our public health department and the county could make a decision to prosecute this and say, hey folks, this is how we think we want to proceed. And I have a feeling that the other ski towns would probably join us, but I think they need to see us leading on this. I'm going to go out on a limb here and say, you know, I'm ready to do this, because if we wait for the governor to make a decision, or the state, will be in the same position we've been in now for the past month, that has kind of been, you know, whittled away while we're waiting to find out what the governor thinks or what the state thinks. I think it's time for us to make a decision, because it's our own ski area and ski town economy that depends upon it, and our health.
And this is one party you don't want to be late to. Simple as that. If you're not ahead of it, you're going to be behind it.
I know the staff is working on a proposal that we may be having a meeting next week. And second of which is, I know people within the Summit leadership as well as EGO are getting a sticker shock as they see the numbers just rise. And as their counties are moving into the ugly red zone, I think there's probably more attention that might be put towards a united request from the ski towns. Kim?
Yeah, and I appreciate all the comments in support of this. I just thinking about this, I think this is a measure, this is a mitigation measure that actually everybody's on a team on. So the economy doesn't have different arguments against public health. The point is is that the economy will stay open more likely and be safer if we enact this type of a mitigation. And so really getting the major stakeholders in the community on board with this as well, in terms of restaurants and lodging and ski-co, is going to really be critical. And I think everybody would be on board about this, because the arguments really lead towards this is going to help keep us open, and without, you know, saying, hey, let's go into lockdown. That's the way I see it.
You know, I think the comments are, Tori, just a minute and I'll call on you. I'll be on that call with Karen on Monday and with CDPHE. I think it's prudent upon Karen and myself, and I think John Peacock's going to be on that call, to have a discussion with CDPHE relative to where our board is and the importance that we both, all three of us and all of the board, place on trying to keep our economy open and trying to be successful. So Tori, you had your hand up. I'm sorry I started talking first.
No, it's quite all right, Marky. Thanks so much. First of all, I would request, I would love to be on that call as well, just to listen, just to hear straight from the state, and bring that back to my council as well. So if that's possible, I would love to join that call. Secondly, on behalf of my city council, I want to advocate for the visitor pledge, traveler requirements, as well as more availability of testing. I think what we're seeing is that, you know, we have been not willing or not able to deploy asymptomatic testing, but my experience, even here in the last week, has been that that is invaluable for people to know that they are carrying this virus. So we are, and as it was shown here, that over half of the transmissions that we're seeing are from asymptomatic carriers that do not know that they're carrying it. And we just saw, I just got a message that Clark's Market has run out of those tests that they were made available. I don't know if they're going to get more. I just had a quick text that said that they're out of them. But we have, again, the opportunity that was brought forward by Barry Ramsberg and Jeannie that's been deployed out at the schools. There is testing available. We can get them here. I know that we are working on it currently, but I really want to reiterate that there is support from the city and this city council to get more testing availability for asymptomatic people. This can really be a help here. So I can already tell you, talking to my constituency, they are in support of a lot of these new regulations, requirements, whatever you want to call it, curfews, capacities, working from, I mean, we are prepared and wanting to move as quickly as possible for this. So again, the visitor pledge, traveler requirements, as well as asymptomatic testing are something that this city council, on behalf of our city and our residents, is highly advocating for. There are, of course, challenges to all of this stuff and deploying this stuff, but we have got to figure these out. We've got to get moving on these. Just the visitor pledge alone, we've been talking about this for a month, 2 months more. We need to get moving on it. I agree with what Greg is saying, is that I don't think that we can really wait for the state. And while there are complexities that will be ahead of us because of local compliance and local enforcement and a local program, I think that we need to do whatever we can on a local level and stop waiting for the state. Thanks.
Thank you very much, Tori. I think I'm in the same camp as you are. That ski mountain's opening in 2 weeks.
Yeah.
So and we've got, and the travel rate looks very positive coming in of what type of tourists we're going to see. So, and I look forward to our next discussion, which gets into testing. And Kim, you might want to comment as to where we are with Clark's, but I'll turn this over to John to lead this part of the discussion.
And before we do that, I just want to make a comment, especially like in relation to the visitor pledge. I think we need community. This is all, again, all hands on deck. So it really does take our community partners to push these initiatives forward as well. It can't all be driven by, our team. So I just would ask that you do bring those suggestions to ACRA or Basalt Chamber, kind of all of the different entities, because the more we're talking about it collectively, the better off it's going to actually be happening. We can put the pledge together, but we need our partners to be engaged and responsive and really pushing those out. And they've been good partners. I'm not saying that. I'm just saying this is all community. It's a whole of government, whole of community response right now.
Yeah,
Thank-
just to build on that, Karen, I think for the leadership on this board to engage with the business community, I think the assumption that it is broadly bought into at this point may not be correct. I think we're going to need some leadership from this board to engage with the business community to help with that also.
Wouldn't direction, I mean, is the process here in order to put into a public health order that is a requirement? Let's just take it one piece at a time. The visitor pledge, right? So what we're talking about is visitors that are on their way here or arrived here are signing off on knowing regulations, have not been exposed to COVID, are asymptomatic, et cetera, et cetera. Is that something that would be in a public health order to require of visitors?
Karen?
Yeah, Tori, it could be, again, we're thinking the purpose of the public health order is to have some enforcement component to that. So we'd want to talk about what that is. It's certainly something that can be added to a public health order. Is it more of a request or just a protocol or process that we go through too? So I think it can be both. And if the board thinks that it's better to be in a public health order, then I think we need to talk about what does that mean then to kind of make that happen like enforcement side.
So I'm almost thinking what we've all got to do. We all have our various constituencies, and we've got to get the business community behind these strategies. So needless to say, Tori, you and Ann are the leaders over there, and Aspen and POCC members, and Bill Manson, our new mayor, to be sworn in on Monday night. And myself, we've got some homework to do as we line up our strategy to get the business community here at Snowmass very much on board with what might be coming. And this is when I always ask the media to help as well, is to get the word out.
And Marky, can I make one more comment?
Please.
Yeah, it's important, that our council needs to engage with the business community. Also in terms of ongoing conversations with CAST, the more we can, if the state's not going to do it, the more we can present an even playing field to our visitors, the better. So I think that's another one of a role that we have, is to work with the other ski towns and get them on board. I love Greg's thing. Sure, let's be first in line and first to the game, but I sure want everybody else to join us. So, so we'll be working on that as well.
Thank you, Ann. So let's turn over to testing. John?
You think I'd have that mute button down by now. Go ahead and did you all plug in my slides, or do I need to share my screen?
1 second, John, I'll pull them up.
Okay, thank you. It's a consequence of being late to the party. So just have a few slides, but I think a lot of information to share. And Dave Ressler and I are going to tag team these slides right now. But there's a lot going on to increase testing capacity in Pickens County right now. So the the immediate effort really has been facilitated through the state. And that is the curative tests that you've been hearing about. And there's a history to these tests. These are provided under a state contract. The state is contracted with curative at $125 a test. They're using CARES Act funding. So it runs out on December 30th of this year. And the curative test is an oral swab test. And originally, when the state entered this contract with curative, the idea was to provide testing using CARES Act dollars for underserved, so that could be uninsured, undocumented, otherwise populations who are otherwise having a challenge accessing testing. And they allocated these tests on a per capita basis to counties. And Pickens County was originally allocated 1,000 of these tests that we're working with AVH to distribute. Then in mid and late October, the state started loosening up on the allocation of these tests. And part of it was having surpluses going into the end of the year, combined with the rising case numbers that you just saw. And so it is really as late as October 29th that the state had confirmed that they would open up the use of the curative tests beyond the original populations that they had limited them to. A lot of thanks to the school district and their efforts in having those discussions with the state. Our team had been having discussions around curative for quite a while too. At any rate, to date, we have received, and this may have changed since I put the slide together, I'll let our public health team weigh in. We have received 3,000 tests in Pickens County, and we've placed 2 additional orders. One on Halloween, we placed an order for an additional 6,000 curative tests, and then 3,000 Binax tests, which are an antigen test. And then again, as the state said that we could continue to make requests, we placed a second order for curative and Binax. So in total, we have requested 21,000 tests to be used by December 30th, 2020. And that includes 14,000 of the curative tests. And that does not include the tests that were allocated and have been allocated to the Aspen School District. Those are in addition. The state had also indicated that we would get a kiosk with these tests to distribute them in the community. That kiosk was reassigned on the Front Range as they, I think we're seeing incidence rates go up. So we have begun distributing the tests starting, we're partnering with Aspen Valley Hospital. And I think Jeannie's going to give a little bit of an update on what's been happening with the school district. But right now, we are looking at 2 sites between now and the end of December. The site that AVH has established in Basalt. And then we have been working with the city of Aspen and Aspen Valley Hospital to, instead of waiting for the curative kiosk, set up our own testing site in Aspen to distribute these tests to the community. Dave, I'm wondering if I could pivot to you so you could talk a little bit about the timing of what's happening and the capacity increases in the basalt area and timing for the Aspen site.
Sure. Thanks, John. And before I comment on basalt, I just want to offer a little bit more clarity around the testing here in AVH, and that is just to remind you that the numbers that are reflected in the graphs that were presented by Dr. Levin are for what we call our community testing here in Aspen, having moved into the cautious, they've been in the cautious stage now for quite some time. That's actually just a portion of the testing we're doing here at AVH. Those are for the people that are symptomatic or referred by public health, which have been a significant number of people. We do an equal number of tests or perform an equal number of tests through our laboratory for asymptomatic purposes, people that are traveling and other purposes or feel like they may have been exposed but haven't been contact traced. And that's part of what's been helping keep our positivity rate down is the combination of those tests. So I just wanted to just remind you that when you see those numbers in the tables or in the graphs that Dr. Levin presents, that's just a part of the story. But it's the part of the story we thought was relevant to move to caution and to keep in that table as a measure, because that shows when we're concerned about the rate of testing going up is related to the incidence increasing. Okay, to John's point about basalt, we opened that site, I think it was just last week. And when we first, Alyssa Franklin on our team is really the mastermind behind that program. She is the director of Aspen Valley Primary Care. And that's actually who is performing the tests. They're owned by, that practice is part of the AVH. It's a subsidiary of AVH. We own it, but it is actually performing the tests. And why is that important? That's important because the primary care practice has physicians that are essentially providing the order for the tests. And that's how we are able to get around the order being required. And that's one of the barriers that you and many in the community had asked us to remove. And public health obviously had been advocating for that strongly. So that just opened. When Alyssa first planned for it, we didn't think we had that many tests to work with because we're using Curative there because that solves another problem for us, and that is that Curative has the ability and does notify patients of the results via text and email immediately upon the result being achieved in the Curative lab. So it gives very timely results. Our turnaround time for those tests as a result, not having to go through a middleman, so to speak, has been less than 48 hours, really good turnaround times. And people are getting results in the middle of the night or early morning. So the result reporting is excellent. So that's a real advantage of Curative for us and for the person being tested. So as John mentioned, though, when Alyssa was first planning the site, we didn't think we had that many tests to work with, but now we do, thanks to, as John said, the efforts of Picken County, Public Health, and the schools, and the state, obviously. And so Alyssa immediately started planning for additional capacity that will go into effect this coming Monday. So we're actually going to be open all day, 5 days a week, starting Monday. And that will be very helpful because to put things in perspective, just for the days she's already been open down there, we're triple booking people and have been performing over 30 tests in a half a day. That's a lot of testing going on down there. And I really applaud Alyssa and her team for accomplishing that. But she's been explaining she's been getting even more demand than she's been able to accommodate. So clearly we tapped the community need with that site. It didn't really necessarily come as a surprise, but we're happy to meet the need. So Monday, she will expand to greater capacity down there. So, John, I think that's what did you want me to comment on Aspen as well?
Sure, if you don't mind, Dave.
Okay. So as John mentioned, as the prospect of a kiosk being staffed and supplied by Curative as part of their contract with the state started to diminish just within the last couple of days, literally. John and Karen in Pickens County asked if we'd be willing to step up. And essentially what we're looking at doing is replicating the model that Alyssa has now demonstrated as proof of concept of work in basalt in Aspen on a larger scale. And so Sarah Ott and her team have been pushing for this as well, and we appreciate the partnership, and we're going to work, as John said, with the city of Aspen to bring this site to fruition. In terms of timing, we're literally we have to hire some staff and put in place the same logistics that Alyssa created in basalt. It's you go online, you register online, you get the results in the same fashion that is happening in basalt. So we think it will be fairly easy to replicate the model. We just have some, where exactly is it going to be located? Sarah and her team have already identified at least one site, and printers, and there's some other logistical pieces to put in place. But we want to try to accomplish that by the week of Thanksgiving, because we are anticipating that influx over the holiday. If we can have it up by Monday of that week, which would be that would be next, if we could have it up by the 23rd, we will. But I just want to caution that, I don't know how all of the logistics are going to come together. And so it might take us a little bit longer. So please don't necessarily hold us to it, but that's the objective we've agreed to at that time. So just to recap, basalt expanding to full capacity on the 16th as a target date, which we think we'll meet, and establishing with the city the site in Aspen on the 23rd.
Thanks, Dave. And then I would just note, in terms of availability of these tests, we will also be meeting with the school district on Friday. The state had sent us a notification that they weren't prepared to support the level of serial testing at Aspen School District with the curative tests through the end of the year. I think Jeannie will probably comment on this, that I think for the school district, that's a preferred test. And so we'll be talking about how we might be able to stretch these supplies to serve the whole community, the schools, as well as our community testing needs. And we'll be working through that a little bit tomorrow. So the good news is when you look at the total value of what the state has committed just for this testing, it's almost $1.8 million in testing through curative, not including what Dave and AVH is putting in to get the tests distributed. Do you want to go ahead and flip the slide? And so once those tests run out, though, from the state, we wanted to be sure that we had a model that was sustainable, manage some of the financial risk in the community, and could still provide volumes and ease of access. Right now, we continue to work with really two sets of agreements. One is with an organization, COVID Check Colorado, which is a social benefit enterprise of the Gary Community Investment Company. They're headquartered in Denver and have been created specifically to help Coloradans navigate the COVID-19 pandemic by providing affordable and accessible and reliable testing. And what they really do is, whereas curative is a specific test provided that was developed by the lab and is distributed, what Colorado COVID Check does is it bundles a set of services, including contracts with labs, including a really robust application for scheduling, reporting lab results, doing any insurance building that's appropriate, along with their philanthropic mission, which limits our kind of risks. So basically, these are high throughput sites. They use two tests, a PCR swab test with a 24 to 48 hour turnaround time, and a saliva test out of Anschutz campus through CU, which has a 24-hour turnaround time. What we are looking at doing is establishing 3 sites, continuing providing testing year-round in Basalt and Aspen, and then during high seasons, providing a testing site in Snowmass Village. This would be available for all guests, visitors, second homeowners, residents, anyone who is in need of testing. We are expecting actually to hear back from CCC actually later on today on our conversations. We're estimating that for a year of testing, we would be responsible for the fixed cost of providing these sites. We right now have that at about $800,000, and that does not include contributions, in-kind contributions that the hospital would make. In terms of providing the testing sites, CCC would provide those bundled services and lab contracts. And then we are in the process of working with the hospital to enter into an agreement to operate the sites for collection of samples. The really, I think, exciting news around this is that the 2020 Relief Fund through the Aspen Community Foundation has offered to match our investment in a testing program like this, dollar for dollar. We will be talking to the Board of County Commissioners. This would be a set of agreements entered into by Pickens County upon approval of a budget and direction from the board. We will be talking to the board about that as part of our 2021 budget deliberations on Tuesday, and feel very confident that we'd be able to ramp something like this up. Now, I would just note that we are not completely locked in. We haven't signed an agreement with COVID Check Colorado yet. We are continuing to analyze other options, including curative and other partnerships. But our goal is the same, to try and provide multiple testing sites and capacities that, quite frankly, are double to 3 times what we have today. Dave, is there anything you would add on this?
No, John, I appreciate your reference to the fact that we want to find the best solutions. And I would add to that that's to start. And then once we're rolling with this, we're trying to establish, as John said, a sustainable testing model that will take us through 2021. But John, as you've often commented, we need to keep it on sort of a 30-day time horizon, in 30-day increments, I should say, because there is so much constantly evolving and new modalities being developed and brought to the market that we're going to constantly be scanning that environment to make sure that we're taking advantage of the best technologies. And there was some discussion earlier about rapid testing. And we think we've, all things considered, have very good turnaround times, but they're still not rapid. They're still not same day. So if there are new technologies or modalities that come down the pike, we'll keep our eyes open and adopt them when it makes sense.
Yeah, and our contracts would be structured so that they could go through the year, but that we can change horses if we need to with 30 days notice.
Okay, Cam, did you have some comments as well? And then Jeannie Siebold.
Yep.
And then we'll go into questions. Cam?
Yeah, thanks. So in addition to all of this, the multi-pronged approach that we've been talking about from the beginning in terms of certain testing sites targeting certain populations, that Clark's is up and running in Aspen. They're doing it safely. The samples are being done outside in the parking lot. It is for asymptomatic only. And Tori, I think you mentioned that there was some rumor about them not having enough tests. They have plenty of tests. They have plenty of tests. They have gotten their operational side down. I know they've worked really hard. Leslie Johnson in the pharmacy has really set it up, and she's done a great job. The turnaround time they're saying is between 2 to 4 days. Sometimes it's back at 2 days, sometimes one or more than that, depending on if it's sent out on a Saturday and then you miss Sunday. So it's the timing can be a little different, but they're taking walk-ins now. It's $99. So it is a fee for service type of test. Anybody can walk in. There's a standing order and purchase a test, and there's no insurance is not even collected. So it's a pretty simple process. And I think the exciting news is that they're going to expand into the Snowmass Clarks hopefully soon. So when they get all that down, so it'll be a service that Snowmass Village has as well, as an option to all these others that are coming down the pike. And you know, I think people who are visitors and maybe don't have a car or don't want to go to Aspen, they may be more likely to use this. So and when these other sites are set up, it may be something that people use on a variable down a level. The other sites are all supported by CARES money, which I think is amazing until the end of the year. And this is just another option. And so that rumor is not true. They have plenty of tests and they're ready to go on a walk-in basis. And I think that's it. I think from a physician point of view, I just wanted to make a couple of comments. One is that as we increase and expand testing, especially into asymptomatic testing, it really is important. A couple messages. One is that you understand the meaning of your test. So no test is perfect. There's limitations to every test. The ones that are more rapid, the point of care tests, are more limited. They're not as accurate as these lab-based send-out tests, PCR tests. And so I think whenever you get a negative test, it's never a complete green light to do whatever you want. And I think that's a really important message. And just really understand that there are limitations, especially if you're asymptomatic and you're trying to plan, using a test based on your planning. The 5 commitments are the most important way to decrease disease spread. There will be false negatives, and don't take that as false reassurance. The second thing is the importance, as we move into this model of a standing order, the importance of being in contact with your doctor about your test result, and to have continued contact with your physician if you should start developing symptoms. If you have questions about your symptoms, the Respiratory Evaluation Center is there. If you don't have a doctor or you can't get into your doctor, for a physician to see you in a safe environment. And then the emergency department is always there should your symptoms start getting more severe. And so that's a really important piece. We don't want to take the physicians out of this piece of testing because they're standing orders, especially the local physicians. So I urge you to keep in touch with your doctor, discuss results of your test, what a negative means, what a positive means. The isolation period and the quarantine periods are the same, and the message is the same. And then lastly, it's important, moving on, that PPE, we haven't talked about PPE at all these testing sites. It's important to use PPE, and they will be using PPE, and we have to be tracking that and making sure that we have enough to continue to do all this testing in a really safe way. The Binax Now test will actually require an additional amount of PPE, but in any case, it needs to be done safely. So those are my comments. If anyone has questions, please.
Okay, Jeannie, do you have a report? And then we'll open for all kinds of questions. Jeannie?
So the school district started testing last week, and last week was our pilot week where we figured everything out. And last week we tested 190 staff members and a whole bunch of students. We tested a total of 523 people over 2 days, and we found one positive adult, asymptomatic. We're only testing asymptomatic students and adults, and we found one positive middle school student. And we were able to test everyone from the cottage preschool all the way up to high school. And some of the toddlers needed help. We had PPE on, but most of the kids, even the kindergartners, were able to swab themselves. We made a game, and they were happy to show us that they could produce prodigious amounts of spit. So, and then both of those people that tested positive were contact traced, and we had a bunch of quarantines started. And this week we tested a total of 6 hours, and we tested 369 subjects this week. There weren't as many this week because a lot of kids were out on quarantine, and the high school is currently fully virtual. And so over 6 hours yesterday, we tested 132 adults, and the sample kits were sent out in the afternoon, and we're actually just starting to get the results in right now. So it's about 24-hour turnover, even though the labs for the curative are in San Dimas. And we just sent out another 237 student tests that we did this morning over 3 hours. So we feel like we've streamlined the testing. It's very safe. Most of the kids do it themselves. And we have it's mostly staffed by volunteers, and a lot of medical volunteers, physicians. Dr. Krista Giesel is on our staff as well. And Catherine Sands of Aspen Family Connections has gotten nurses and other volunteers to check the students in, as well as observe the testing. And the kids learn very fast. They're able to do it themselves, and we time them.
Jeannie, yesterday there was an article about Aspen School District may be required to go to a different type of test.
Yes, so we're looking at this Binax Now test, which the CDPHE has gotten from the Health and Human Services. And I think the Trump administration bought millions of these tests, and they're distributing them to various school districts and prisons and historic Black colleges all over the United States. And they've offered us as many of those tests as we want, except now we're going to need a lot more PPE. We're going to do those tests, and those tests take 15 minutes for the results. So someone would have to be sitting there for 15 minutes. The curative tests take about 30 seconds to collect the sample, and we can do literally like 500 patients a day. But I just don't know how we're going to sort through the logistics of the Binax Now test. We're going to discuss that tomorrow with our meeting.
Okay,
The nice
question.
thing about the Buy Next Now is you know immediately, but there are much higher false positives and false negatives with antigen tests.
Well, question for you, Jeannie. Does the CDBAG tell you what type of test you're going to use, or is that a local decision at Aspen School District?
Well, I think it's an availability issue. So I think the school district is, we've worked out the whole curative logistics, and we could test 2,000 people a week there easily with our volunteers. And I just don't know how we're going to work through the logistics of the BINAX. Plus, we'll be getting a lot more false positives, and then with those false positives, we'll have to back it up with another test, a PCR test, a molecular test. And we don't want to put everyone in quarantine with those false positives, since the goal of testing is to keep our kids in school.
Thank you, Jeannie. You know, there's a question that I would ask that perhaps my over 70-year-old brain doesn't understand. And that is, it seems as though the school system has been able to access a lot of curative tests through CARES. And we've had a hard time at the county level getting curative tests. How is it, or why is it, this is probably John Peacock question. How is it and why is it that Aspen School District is able to have so many tests and we within the community haven't had that capability?
Yeah, so actually we do have that capability. That's the, the 14,000 tests that we are expecting to get from the state. The state pivoted in mid to late October, Marky. So prior to that, the state, and Jeannie, I think you were on some of these emails, the state was very clear that the intent of the test was for underserved populations. And at that point, we were allocated 1,000 tests for Pickens County. As the state pivoted really in late October, they started opening that up. And to be honest, I don't think that was made clear to all communities right now. And the state is still figuring out how to distribute those. So for example, I think it's fair to say that the school district left a meeting, it's either on the 29th or 30th, it's towards the end of October, and so did our staff, thinking that CDPHE had committed to as many curative tests as the school needed for the serial testing. But then recently, this last week, said, well, wait a second, maybe not that many. So this is a pivot that the state's made pretty recently. We're really happy that the school's been able to access those. They got the first mass shipment, and I think to a certain degree that makes sense as we establish keeping the schools open as one of our top priorities. But we have gotten these tests now for our community. We've had 3,000 delivered so far, but a commitment for the additional. And if you look at those 14,000 curative tests that for the community, the state is paying 1.7 million for those. For the school district to do the weekly testing, I think you said you could do 2,000 with all the self-swabbing. But that's $250,000 a week. So I think the state opened the doors and is trying to meter it a little bit more now because they've got 64 counties and 180 school districts to serve. So we have both gotten access to these. The school got the first mass shipments and ours for the community are coming. And this pivot all happened at the end of October.
Okay, Kim?
Yeah, I also, on top of what John's comment, is that I see that there's been a second pivot at the same time that John's pivot. From my perspective, the emergency use authorization for these tests includes symptomatic testing only. For curative, it's within 14 days. There's other tests that are even more restrictive, but curative, the EUA for curative is for symptomatic only within 14 days. With this pivot that has occurred just recently, is that these labs have now addressed, well, asymptomatic testing in congregate repetitive settings, that these tests may be useful and applied to that as well. So it's kind of like this redefinition, whereas before, up to really the end of October, this has been pointed at symptomatic testing only. Now we're looking at asymptomatic in the schools, and are these tests appropriate for that? Well, there's been this expansion of the definition from the original EUA that most labs are now going to, and saying really just in congregate settings and asymptomatic testing may apply as well, although there's limitations, again, because the test is more effective for symptom in terms of being a better test if people have symptoms within 14 days. So I just wanted to mention that as well. And all that's kind of happened at the same time. It's just been interesting changes that have been so rapid.
Thank you. I'll see if other board members have questions. Yeah, Krista.
So John, I just wanted to, and this has been a question that I've just kind of had since the last email exchange I saw you were on with the state, is that do all these tests, these 14,000 coming, do they all have to be used by December 30th? We have to use every single one of them?
Yeah.
Okay.
Yeah, otherwise that cost is going to come to us. And that's why we've been trying to build a mousetrap where we don't absorb the variable cost so much as a fixed cost on the testing.
So John, relative to that, we know that at any given point with ski season opens, we can have up to 40,000 here within in Pickett County. That's a lot of folks, and I think we'll run out of all those tests by Christmas.
No, well, possibly, but that's not the only testing that's going on. That's in addition to the testing that we're already doing and that we're attempting, to ramp up. We set the 1/1/2020. If we can ramp up sooner, I think we'll be doing that. I will say that if you use that metric and of 150 tests a day per 100,000 in population, we're going to be pretty well positioned even with our visitors. Our census population is just under 18,000, but we know that doesn't tell the story, right? We tend to peak out at a population of around 53,000 in a normal year. This year, it's probably going to be a little bit less, but we'll easily, be able to accommodate those populations of 40 to 45,000 with the capacity that we're building, Marky.
Thank you, John. Any other?
Marky, this is Kurt. I wanted to add the Bionex Now tests. The health department, we're also receiving those from the state health department. We've ordered 7,000, and I believe earlier this week we got our first shipment with 1,280 of them. And as Jeannie and Kim started talking about, it's an antigen test that is a rapid test. So the great thing is you get results in 15 minutes, but there are a number of limitations. You have to use full PPE. It's a nasal swab. And if you get a negative test, you actually have to confirm that with a PCR as well. So there's some limitations, but there's some additional tests that we have coming as well that will help with that.
Thank you. How about other members of the board? Yeah, Tom.
I think it's certainly interesting to see these additional forms of testing come forth at this critical time. And I would encourage people to get them implemented as soon as possible, and applaud Kim and her efforts to do such through Clark's Market and that field. In addition, I think it's of concern because we're concerned about the travelers coming in to work out a way to perhaps those who answer positive questions at the airport to be referred to a testing center as they come in and be tested then. Because we have potentially 14,000 additional tests, that those would be used in that manner, perhaps.
Thank you, Tom. Other comments, other questions? Okay. John, I want to thank you and all your hard work working on this with Dave and with Cam. And it's a lot going on. I see Greg Postman waving at me. Go
Well, I
for
wasn't
it.
sure you could see me. I saw Tori's got his hand up also. I did have a question just regarding the way we talk about schools and classrooms and the example that Josh gave. You know, nobody's in a classroom for an hour or two. I think if you're in an elementary or middle school class, you may be there for 8 hours, but you might have fewer students. So I'm wondering, while we're conducting and looking at these studies, are there any that actually reflect the reality of what we have going on in our schools now? I've had the opportunity to spend a couple days up there in the last couple of weeks, and if you're in a classroom, you're there for quite a long period of time, but it's with fewer kids, and it may or may not be with ventilation. I'm just trying to figure out how that information is going to be. We can have more useful information. Maybe that's just a comment on those. But I did want to ask a couple of other things. I've seen reports, some from Tom Kurt, who forwards a lot of interesting stuff about communities that are doing testing along with flu inoculations at the same time. Once that you get them into the clinic or into the space, is there a way we can offer this? Because we keep talking about getting inoculated. Is there a way we can combine efforts, as many communities are doing? We've talked about being proactive with the tourist testing. I did want to say that my fellow commissioners, George Newman and Kelly, have weighed in and written us notes and have been sending me notes saying they really would support us reaching out to other counties to begin with, to really pressure the state, but to take a leadership role. And Kelly was very concerned, had several good points about disseminating information, getting the traveler requirements out, finding the partnerships with the ski company and the hotels and maybe VRBOs, working with the airport and the FBO that may not have any sort of gate, as Tori has noted, for people coming in to the community. Her last comment I thought was really pertinent is that she said, all four corners of the box are being stretched, so more protective measures are needed so we don't break this box that we're trying to create, boxing it in. As a substitute teacher, I've been doing about a day a week up at the school. I'm on staff now, so I was tested, and I can report that my test came back negative, thankfully, but it came back in about 46 hours. It was amazing how efficient it was. I think Katie Frisch and Krista administered the test. I did it very quickly in 3 or 4 minutes, and I had my results texted to me in 46 hours. And if the lab wasn't in Los Angeles, it would have probably been within a couple of hours. So I can see testing is going to be getting better and easier. The next question that comes along is, if testing is so easy, some people will be getting tested 2 and 3 times a week. Do we have to worry about how we regulate the number of tests that are administered and who gets tested and when, just so we don't run out? If we get this wealth of tests now and we're all this money until the 31st, I just want to make sure we don't burn through our testing inventory. And what mechanisms will we have in place to make sure we're testing as needed and not because people want to get tested every other day? Thanks.
So I'll just answer the last question real quick, if is that okay, Marky?
Yep, waiting for you.
So just real briefly, the tests that the state are providing, we need to use by December 30th. So our goal is going to be to get those out in the community, those curative tests, the ones that Greg was talking about having experience with. I do think that as we go into 2021, part of sustainability, Greg, is exactly what you're talking about, because everyone wants to think these tests are free, but they're not. Somebody The real question is who's paying for them. Right now, we have the federal government who stepped in on these and state till December 30th. We're not counting on that same support, frankly, to finish out the winter. We don't think there's going to be a new bill. And so that's going to be a combination of getting billed to insurance and really relying on philanthropic or at-risk kind of contracts that folks are willing to get into. And Greg, to your point, the higher the volume, particularly amongst uninsured or those who can't pay, the more stress it's going to put on somebody to come up with that funding. You know, obviously we're putting a proposal in front of the board to take lead on doing some of that. The hospital's coming to the table, and thankfully we have folks in this community, philanthropists who are making a commitment. But just like we've been talking about with all this, none of it's unlimited. And so we're trying to use it in the wisest way and get it spread as broadly as possible to protect the health of the community.
Thank you. Do I have any other comments or questions? Tori?
Mute.
Tori?
You're muted.
Nope, can't hear you. Okay, I'm going to go on over to Ann. And then I saw Jeannie Seabold with her hand up. Go ahead.
I was just going to tell Tori he was muted, but it doesn't appear he is. So no comment, sorry.
Okay, Jeannie?
I just wanted to tell Greg that I'm also a substitute, and I know that they've upgraded their HVAC system to bipolar ionization HVAC system. So being in school is one of the safest places you can be right now, given the increased sanitation and the mandatory masks. So I feel safer in school than anywhere else in Aspen.
That's a great plug for substituting, Jeannie. And I know the school desperately needs substitute teachers. So if anybody has a day every couple weeks even, they would probably love to hear from you. It's not too hard to become qualified or certified. I did it. You know, they overlooked my
high school diploma.
Right.
Okay.
The other comment is spread is not happening in the schools, it's happening outside of schools. The reason why kids are being quarantined is because of these parties that went in violation of the public health order. So they were all high school kids, and kids went to these parties even though there were sick family members. So we're not enforcing anything, but people should have a little more common sense. And it's not just the kids getting infected, they're coming back and infecting their younger siblings and their grandma and other people. So we should be a little smarter when it comes to going to parties right now.
Thank you. I'm looking at the time. We've got about 5 minutes. Linda, I'll let you make a comment, and then we've got to discuss the next board meeting.
I just wanted to make a comment if the press could push Clark's with Thanksgiving coming up and having people that are getting together in small groups even to possibly test prior to getting together, because I think there will be groups that are not staying small and expanding, and you're going to have our numbers are going to go up drastically if we don't start to promote people taking advantage of Clark's Market and signing up to get tested. So I would highly recommend that.
Great note.
Margie, Tori, you back? Can you talk now? He still can't. Tori has been texting me his questions. So if you don't mind, I'll share his questions. The first one is, when is community testing being deployed? When are we going to public health order traveler requirements is the question Tori's asking. And that kind of ties in with my next quick comment was, this is a huge workload for our public health staff. And I'm just wondering if we should think about forming some working groups from this board to tackle some of these issues that we have before us. There's a list I've been making that's pretty daunting. And I keep thinking, if rather than waiting for someone else to do it, maybe we need to divvy up some responsibilities and dig in here as a Board of Health.
I'm fine with that. Since I'll be unemployed on the 16th.
You'll put you in the first volunteer, you're right in front of the volunteer list. Certainly.
But I think that's a great idea. Perhaps you could share that list. And then I could work effectively with Karen and whoever the next interim director will be as Karen gets ready to head to Wasilla.
And Tori, you can email us also, since you've been muted. How inconvenient for you as the spokesperson.
Okay. Yeah, Ann?
Yeah, I was going to say, Tori, text me too. I'm happy to to repeat your questions. So there was some discussion about Marky's continued participation in the board. And Karen, do you want to address that, or is this the time to talk about that?
Sure, I can so as you all know, Marky is leaving her post as the mayor. But we did looked at the bylaws and reviewed the official resolution that was passed when this board was created. And from the language in both those documents, it is up to the town of Snowmass Village to determine who they would like to appoint to the Board of Health, and it doesn't necessarily have to be an elected official. And so I put that back to the town of Snowmass Council as well as Clint to just let them know that. And so if there's a recommendation from the Board of Health around that, I think that could be an option to bring forth.
Okay, well, I would like to discuss that. I also have one more question from Tori. So however you want to go forward. Let me give you Tori's question real quick. When is Aspen community testing being deployed?
I don't know if Dave is still on, but are you there, Dave? Oh, you're probably better to answer that.
Yeah, I know this is a hard communications because I'm not exactly sure what community testing we're talking about, because we've been doing community testing all along. But Tori, if you're talking about the Aspen site, not if you are, the Aspen site, okay. That is what we are working with Sarah to deploy. Earlier in the call, I had said we were targeting Monday the 23rd before Thanksgiving, because we were hoping for the kiosk, and that seems to have faded. So we got to get the logistics in place, the location and the staff, et cetera. So we're targeting the 23rd.
Great. And then if I could follow up on the other subject, of course, it's up to the town of Snowmass. And Bill, I see you're on the line also as the new mayor. Congratulations. It's up to you to make the decision. I think with Karen leaving, sadly, and during this crisis, the continuity of having someone that's worked all the way through it from the beginning to end, as well as put together our current Board of Health, it would be important to have Marky continue on the board. Again, like I said, up to the town of Snowmass Village, but if the rest of the Board of Health, hi, Bill.
I'm in full support of keeping Marky on the board. I think she's doing a great job there.
Oh, okay. Because I was going to suggest we write a letter supporting that position, but however you want to move forward then. Thanks, Bill.
I think Marky does an excellent job chairing and listening to people, and I recommend her also on that basis.
Well, thank you. I think I do a pretty poor job watching hands go up and trying to, poor Tori's trying to make a comment and you know, it is what it is. And it's an honor to chair the board, and it's an honor to work with every one of you. A board is only as good as everyone that we link together and make it happen. And this board has been incredible. So needless to say, we want all of you to stay as well. No resignations allowed. Brent?
Yeah, I was just going to second everybody else. You know, you're greatly appreciated. And are we into some sort of a round robin, or at this point to bring up something else?
Yeah, I'm going to do round robin. I know we're working, we're running a little late. But before we do round robin, we need to determine the date of the next meeting. And second of which is, I think that we all want to thank Karen. She will be at the next meeting for sure. And I think her last day is the 4th of December, if I remember correctly. So Karen, could you talk a little bit about where you're going and what you will be doing? And we don't want you to go as part of this, but go ahead.
Sure. So I am, as you all I think are aware, I grew up in Alaska and have opportunity to go back there. It's a place that's really near and dear to my heart. I'll be working in a community just about 45 minutes north of Anchorage for a small health foundation. And at the health foundation, I'll be overseeing their programs. So I'll be the vice president of programs within the foundation, and all of the program officers will kind of fall under my purview. So they're the ones that get to have the privilege of giving money out to the community to support the best public health work in that community. And it's a really, I feel like it's a really privileged space to be in a foundation. You have an ability to make change with financial resources for communities. The foundation is really prioritizing equity as a core piece of the work that they do, and are really trying to morph and move their board and their organization more in an equity focus, which, as you all I think are aware, that's a real strong value of mine and something that I really resonates with me and what I try to bring forth in the work that I do as best I can. And so it's just a great opportunity for me to do that work in a different sector. And I'm really looking forward to connecting back to my friends and to the land of Alaska. So that's my plan.
And Marky, we did contemplate putting a quarantine order on Karen so she couldn't leave, but she lives in Eagle County, so we couldn't make it happen.
Garfield County, good try.
Oh, Garfield, yeah, I wasn't gonna get it.
And I just want to point out, you're leaving a cold climate for terrible weather, Karen. You need to think about this.
Well, honestly, Pickens County winters have just gotten too warm for me and too short.
And we were joking earlier, as Karen goes to Wasilla, to a job where Sarah Palin lives, the duct tape capital of the world. We want to know when she sees Russia. So can you send us all an email when you see Russia from Wasilla? Okay, let's move on to the date of our next meeting. Karen, you had some comments.
Yeah, so I think originally we recognized the next official board meeting was in 2 weeks on the Thanksgiving holiday. So we had thought about maybe pushing that forward in that week and doing more of an updated meeting, knowing that there is some interest in some of the shopping around some of those topics with constituencies. We do really believe that any of those things that were on that slide need to be brought forth to different stakeholders. So whether that's bringing it to the winter planning meeting or bringing it to your cast or other, the Northwest COG, kind of all the places that I think we want to get support, that there would be a little bit of a time factor in that, but also recognizing that there's some immediacy on timing as well. So I think we're open to an idea of a meeting next week, but the Thursday time slot is already taken with a community meeting. We have a community meeting scheduled at 1 o'clock, which many of my team will be on. So I I guess I'm proposing one or the other, and that we would have to try to negotiate a time for next week if that's the case, because we don't really have that slotted normally as we would. But we need to do it at the end of the week because we need time to shop those things around. We really don't want to, surprise our community without, like I said, having some buy-in from key players in our community and key groups in our community that will be impacted by those decisions.
So my thought was to do it before Thanksgiving, Tuesday or Wednesday. I don't know what your availability might be. To push it early or late next week, I think is kind of pushing. But I want to get the flavor of the board. I don't see any hands going up. Hey, Tom. Tom?
I'm not sure whether you're asking for a vote for next Tuesday or.
Tori's saying next week.
Next week would have to be like a Friday. Greg is saying yes. Karen, would we all be prepared to discuss community participation in those conversations by next Friday? And then next steps, Karen, would your staff be prepared?
Yes, so sorry, Kara just let me know that the community meeting ends at 2 on Thursday, so there might be an opportunity to do it after that. But again, we want to give ourselves enough time to, we're asking the board to do some work here in that kind of beginning part of the week, and our team needs to have some time to do that as well.
Well, I'm looking at all of my board, and I would suggest this becomes priority number one in terms of getting our economy open and really getting going at the tourist season, which is upon us right now. So I would be fine with suggesting 2:30 next Thursday, so everybody gets a break before we go into a meeting. How about the rest of you? Thumbs up? Okay, next Thursday at 2:30, and we look forward to hearing comments coming back from all of the linkages that you will be doing in your various communities and to your various organizations you work with. Now that it's 3:40, and I'm a bad girl because I didn't keep right to the clock. So anything else to come before the board?
Marky?
Yeah, Greg?
Because I brought it up earlier regarding, oh, sorry, somebody else. Brent, go ahead, Brent.
Well, I'm just going to say the next few dates, are we still meeting Christmas Eve day, 12/24? That was on the list. Or are we just going to take it a time there?
Going from week to week right now, I think, or board meeting to board meeting. There's so many.
Okay, fair enough.
Yeah, Greg.
Right, okay, fair enough. And then the other thing is I just want, go ahead, Greg, sorry.
Oh, no, go finish. Go ahead, finish.
Well, I was just going to say that we talked about, communication being so important regardless of what's going on. And I'm not quite sure the status of how we handle Pick and Alert, but I can tell you that in Los Angeles, we get these alerts, it seems like every week, and every cell phone goes off simultaneously. And this last one I just got yesterday says COVID-19 cases are increasing. Please wear a mask and social distance. Get tested if you have symptoms. And they have the link. And I'll tell you, it's a very impressive thing when everybody around you, if you have anybody around you, but whatever, they all go off. It's like an Amber Alert, and it really focuses your attention, and it makes you feel that other people must feel this is very, very important to do this kind of thing. So I'm just saying that whatever communicative or communication links we're looking at, this is something I think that's pretty forceful and pretty convincing. That's it.
Thank you. It's a great idea, Brent. Greg?
Yeah, very quickly, I just wanted to say, I brought up the suggestion that we break up, some of these tasks, and I was going to leave it to you and staff to help assign, prioritize the list and maybe help even assign it to board members. And I'll send you what I have, but I just wanted to make sure people understand that they're probably going to be hearing from you. I'm going to guess it's you sending them out, or Karen. That's the first thing. And the second thing, I just wanted to call attention to an article that that Tom Kurt sent us last week. It was a Washington Post article, American Medical Association Journal referenced it on how cafes and restaurants are really turning out to be places where we're seeing a lot of spread. And it's kind of the elephant in the room, and we haven't discussed that today, but it's certainly something to keep in mind. And I have such sympathy for our local restaurant community, but we're seeing information coming from cell phone data that says, this is where it's happening, folks, and to a fairly good extent. And we talked about it a little bit, but I just wanted to keep that in our minds as we go forward with this outreach, because the last thing I want to see is a reduction, but it seems that, you know, this is where it's happening. Thanks for that.
Yeah, we're probably going to hear that on Monday about a reduction in restaurants and everything else. So not fun. We just all got to buckle down and remind all of your friends of the public health issues that we've got in front of us in the caseload we've got now. Okay, do I have a motion to adjourn?
So moved.
Do I have a second? All in support?
Second.
Okay.
Aye.
The meeting is adjourned until next Thursday at 2:30. Good job, everyone, and thank you all with presentations. Wow, what we have in front of us is pretty daunting. So thank you.
Bye, all.
Thank you, everybody.
Come back now? Can you hear me now?
Oh, yeah.
Yes, we can.
What
just happened?
I just left it and came back in.
Yeah.
All right. Thank you, guys. I know the meeting's over. I'll connect with you separately. Thank you for all the work today. I'm looking forward to getting some of this stuff done. So I'm on it. Thank you, guys.
Thank you, thank you, thank
Bye,
you.
Tori. Bye, everybody.
Thanks,
Bye.
Marky.
Hey, yeah.
Yeah.